Hi, everyone. Thank you for joining us today for our session, Movements, Organizing and Empowerment in the Time of COVID-19. My name is Sukti Dhital, and I'm the Executive Director of the Bernstein Institute for Human Rights at New York's NYU School of Law. It's truly an honor and privilege to serve as the moderator for today's session. This virtual event is part of the incredible series, COVID-19, Advancing Rights and Justice During a Pandemic, convened by Columbia Law School's Human Rights Institute, Duke Law School's International Human Rights Clinic, the Center for Gender and Sexuality Law at Columbia Law School, Just Security, and for today's session, co-sponsored by the Global Justice Clinic and the Bernstein Institute at NYU. I will now briefly introduce the panel topic, the speakers, and the format for today's program, and then we will get started. So movements, organizing, and empowerment in the time of COVID-19 centers on the fact that the pandemic is quite literally pushing people apart. Physical distancing makes traditional forms of organizing and activism, such as rallies, protests, know your rights trainings, the real people power generated by physical proximity, impossible. And we've seen how the pandemic is already exacerbating pre-existing inequities and disproportionately affecting communities and people that are already marginalized. So today we're going to talk through ways organizations and social movements are shifting tactics to continue to build power of marginalized communities in this new era. To take us deep into this work, we have an incredible group of social justice warriors who engage in creative, community-driven approaches to build power and advance justice. I am honored to introduce the panelists in the order that they will be speaking. First, we'll hear from Antonio Gutierrez, co-founder and coordinator of strategic development and operations at Organized Communities Against Deportations, also known as OCAD. Antonio also co-founded the Albany Park Defense Network and Autonomous Tenants Union in Illinois. Next up, we'll hear from Tawana Petty, the director of the Data Justice Program at Detroit Community Technology Project. Tawana is also a mother, a youth advocate, a poet, and an author. We also have with us Michelle Morse, founding co-director of Equal Health, an assistant professor at Harvard Medical School, and a Robert Wood Johnson Foundation Health Policy Fellow. And to take us home, we have Shawn Sebastian, senior strategist at People's Action and director of the Fed Up campaign. Each of our panelists will speak for around 8 minutes, and then we'll turn to the Q&A section of the program. Please do note that we will take questions from the audience via the Zoom Q&A function and Twitter. We ask participants to send their questions via the hashtag COVID-19Justice. And we will do our best to get to as many questions as possible. With that, I hand it over to you, Antonio.
Thank you so much for having me today to speak with you, all of you. Again, my name is Antonio Gutierrez. I'm a gender nonconforming individual, so I prefer to use they, them, their pronouns. And I'm going to be talking about the work that Organized Communities Against Deportation does in Chicago, Illinois. So we have been doing anti-deportation work since 2012. We shifted our work from the Immigrant Justice League and undocumented-led youth group that was doing work around the DREAM Act, around deferred action, but we started seeing an increase of deportations during the Obama administration, and that's when we shifted into OCAD's existing work that we do right now. That work itself has shifted now due to COVID-19 and some of the changes that we have done, most primarily around the tactics of organizing, right? So what are some of the tactics or strategies around digital organizing that we need to implement during COVID-19? As an organization, right, we believe in relationship building with our membership and our leaders. We work with families and individuals that are undocumented to resist their deportation by providing legal aid strategy and organizing strategy and making them their best advocate by empowering them and allowing them to understand, right, that their story, their voice can inspire others to fight the system that terrorizes and oppresses us every day as undocumented immigrants. And so when you do that type of empowerment or work that really is about relationship building, it's really difficult to do it through a screen, right? And so one of the things that we had to like shift very drastically is our community spaces, right? So we had to have, we used to have a community meeting every first and third Saturday of the month. That was for all of our membership and public at large to come and learn about our current campaigns, to do some political education, and constantly build that type of empowerment and relationship building. Now with COVID-19, right, we don't want to have any type of setting that includes more than 5 or 10 individuals, right? And so we've been having these type of community assemblies now on Zoom, which has also been challenging and also has shown drastic effects that has brought out to our leadership, right? First, from walking our membership to how to log in into a Zoom meeting itself, right? And making an instructional video to make sure that people understand that process from step A to step like B. The other way that our work has shifted, right, is that we're putting now emphasis on the detention centers themselves. I think we all have heard both on local and national news, right, that continuously we're seeing more and more cases of positive instances of either guards or individuals in detention centers with COVID-19, right? And we fear that due to the conditions that are already pre-existing due to COVID-19, right, such as the proximity of people in detention center and how they share cells, they share sometimes restrooms for multiple individuals. And so with knowing many of these conditions ourselves, we were very worried when we started hearing about the COVID-19 coming to the United States and kind of what its effects could have, not just within the immigration detention centers, but also any other type of federal prison where Black and brown bodies are kept, as we all understand, kind of the mass incarceration issue that we have in the United States. And so with that, we joined a national organization, the Detention Watch Network, in their efforts to bring up the campaign Free Them All. And so this campaign, OCAD is the leading organization in the state of Illinois, leading it, where we are demanding Governor Pritzker and the different elected officials that could make this happen, right, and pressure ICE or the Midwest field director of ICE, Immigration and Customs Enforcement, Robert Guardian, to release all individuals, especially those with health risk at this moment of crisis, that we really fear what a pandemic can look like inside a detention center. I'll be sharing the petition that we have online, right, with all of you so that you all can sign and share with your networks. But we definitely want to build more of this pressure, not just here in Illinois, right, but anywhere nationally in order to get individuals out of detention centers. We know that ICE is still detaining individuals and that they're also not able to deport many individuals, as many countries have not closed their borders to travel. And so we know that individuals are being placed in detention kind of indefinitely with conditions where they cannot stand more than 3 feet away from one another, where they're sharing restrooms with 20 or 30 individuals at the same time, where there's no hand sanitizer or antibacterial wipes available to the inmates. And so these are very worrying times, not just based on how COVID-19 is affecting our communities at large, right, but also what other effects we still have not seen and that we need to be aware of, that we might be looking into the future if we don't act now. The other way that OCAD is also responding to the COVID-19, working mostly with an undocumented community, right, which undocumented communities have been excluded from the multiple stimulus package support process that the government is trying to relieve many individuals economically around the economic effect that COVID-19 has been having in their lives. Undocumented individuals are left out from the stimulus package, right, and they're also not able to apply for unemployment because of their status as well, right? And so when you have a large majority of essential workers in our nation that don't have public health benefits, that don't have benefits such as unemployment, or that don't have access to governmental financial support, then we need to really start worrying about what is going to happen to this community of essential workers that keep our society running, especially in these moments of crisis. And as a response, OCAD started a mutual aid fund that is really only encompassing the uniqueness of the mutual aid fund that we have created is that it is for undocumented families that are facing deportation and financial hardship during this crisis. Is we understand that there are definitely multiple mutual aid funds that have been created, right? And that is also an effort that I think as a nation we have seen the efforts of supporting one another, and not really around charity, right? But really solidarity work that we are doing. So that's another way that we're supporting individuals. We are in relationship with food pantries here, local coordination in the neighborhoods where our membership and leadership lives, right? And we have created either funneling donation money to them so that they can keep their stocks of their inventory high, and also knowing that at any point, the increase of food requests can also increase, right? I myself answering the Spanish calls of the food pantry that we have here in Albany Park, the neighborhood that I live in, which is one of the most diverse neighborhoods, not only in the city of Chicago, but also in the nation, right, where we speak 40 different languages. It's known as an immigrant entry poor neighborhood. And so answering just the Spanish calls the last 4 weeks have been going from 1 to 2 calls a week, right, to now receiving at least 1 to 2 calls a day, right? And it's only increasing. And so I would urge everyone to also promote and donate to those food pantries that are only going to see most likely a wave of different requests in the upcoming weeks itself. And then as far as the work that we're doing, right, besides the Free Them All campaign and highlighting the public demand to free all individuals that are currently in detention centers in the state of Illinois and also nationwide, we have 2 individuals that we're working on their public campaigns currently. And these 2 individuals are in detention. They're in 2 different detention centers within the state of Illinois. And so we're calling out for the release. And the way that OCAD works really well with litigators or legal aid organizations, right, is that we combine our organizing demand and make sure that we work with legal aids that might be able to provide a legal strategy or a tactic that might be able to create either a win for that case, right, or at least create leverage in order for us to have negotiations and conversations with the stakeholders that can make our demand possible. So in the case of the 2 individuals that we have currently that are in detention, we have filed habeases for both of them, right? The legal teams have filed these 2 things, and now we're waiting for kind of either an acceptance or denial in order to move into a more litigating stage. If accepted, we see a habeas petition request as something that could be set as a precedent at the moment of time, right? So that other people can either file it on behalf of the individuals that are in detention, or even creating a pro se aspect of how individuals can file for their own habeas while in detention center, right? And so I'll kind of stop there. I look forward to more questions as I kind of like that much more of these type of panelists of events. And I'll leave it up to for you all to kind of learn about the different work that OCAD does. But I will put in here the link for the petition for the Free Them All campaign here in the state of Illinois. And then also an event that we're having tomorrow where we're going to be speaking with Francisco Roman, one of the individuals that is currently in detention, where he's going to be talking about his habeas, but also the conditions that he's seen every day within the detention center that he's placed in. Thank you.
Thank you so much, Antonio. Very much appreciated the solidarity, not charity. That rings true. So we're excited to come back to you with questions. Now we'll turn it over to you, Tawana.
Thank you. Wow, Antonio, I could barely catch my breath listening to all that amazing work you're doing. It's tremendous. So my name is Tawana. I am also known as Honeycomb because I'm a lifelong poet, and a lot of folks in Detroit and across the world know me as Honeycomb. So you're welcome to call me either one. So I serve as the director of the Data Justice Program for Detroit Community Technology Project. I'm also a convening member of Detroit Digital Justice Coalition, and I have my hands in a lot of different work in Detroit, including I serve on the board of the James and Grace Lee Boggs Center to Nurture Community Leadership. I co-lead a team with Detroit Equity Action Lab, and I also am a recent Digital Civil Society Lab Fellow with Stanford PAX. So I'm adding all of my kind of lifelong grassroots on the ground activism and learning with some now technical expertise and digital justice superstars around the world, including yourself. So I'm really, truly grateful for that opportunity. So currently, through my data justice work, I'm going to break this up in a few little scenarios, but currently through my data justice work, I am in a struggle with a lot of coalition members against mass surveillance in Detroit. So I live in a city that is more than 80% Black. What we like to consider, we don't like to consider, but it is, the reality is that it's one of the last remaining Black meccas in the United States. And so a lot of policies that get to succeed here get rolled out in smaller, predominantly Black demographics across the country. And so we find it that we have to really strongly resist some of those policies. Otherwise, there isn't much hope for our comrades who are all across the country. As an example, Project Greenlight is one of the most pervasive systems that we have right now, where there are approximately 700 flashing green light surveillance cameras that are connected to real-time crime centers, connected to law enforcement. So they're monitored 24 hours a day by law enforcement, and they can also monitor them from their cell phones. And they now have access to facial recognition technology to leverage the still images from those cameras in order to attempt to locate what people that they might deem criminals. And I use that in quotations. Because of a lot of our activism over the last couple of years, they're no longer able to use that technology in real time. So as an example, in Baltimore, during the Freddie Gray protests, law enforcement was able to use facial recognition technology to target community members and activists and organizers for traffic tickets, as an example. So take their cell phones and just wipe them through the crowd, identify a person in real time, and then determine whether they had any outstanding warrants or traffic tickets or any other violations. So we have not been successful in banning facial recognition in Detroit yet, but we have been able to push back the policies drastically. One of the reasons why we haven't been able to fight off facial recognition yet in Detroit is because we're predominantly Black. So if you look at cities that have been successful with banning facial recognition, they've all been predominantly white, with the exception of one, which is heavily white, not predominantly, but close to predominantly white. And so I have been in great coalition with those organizers in different cities, in different states, and all across the world, in trying to leverage strategies that we could then adjust for the needs of a Black city. In addition to that, we organize what's called data discotheques, discotheque being a play on words, short for discovering technology. And there are these tech fairs where we bring community members together to educate them on media literacy, to answer their questions around and their anxieties around the census, to teach them about Project Greenlight, to teach them about facial recognition, to teach them about equity within digital justice spaces, and really serve the needs of community members as they ask for them. And so we do them all throughout the city, and they are co-organized by what we call a community liaison, who would be a member that lives in that neighborhood and wants to have particular workshops in their neighborhood. And then additionally, I am a co-founder and on the editorial board of Riverwise Magazine, which is a magazine by Detroiters for Detroiters, and it lifts up the stories of Detroit residents and their organizing and initiatives within their neighborhoods and across the city. We know that living in a city that is predominantly Black, that the narrative has been one particular way, especially for Detroit, for almost a half century. And so we've had to take control of the narrative of the city to uplift the stories of community members that have been resisting and fighting these systems and co-creating and being geniuses all across the city for my entire lifetime and before. Unfortunately, I've existed in a city that's had only one dominant negative narrative my entire lifetime. And so this type of organizing has been complicated with the pandemic, especially because we're dying. We're a hot spot. We're the 10th largest state in the country, but we're currently third with deaths in the country for COVID-19. I can no longer count on almost two hands how many people that I personally know who have died from this virus. And that is continuing to happen every single week. And so not only the disparities that are in the healthcare system, but the fact that there are thousands of residents within a city who still don't have water at the height of a pandemic. One of the main things that they consistently tell you is that you need to have proper hygiene. You need to wash your hands. You need to be able to clean your surfaces. And we still have residents in our city that don't have water on. And our city, our median income prior to the pandemic was $29,000 a year. So you're looking at the median income of a large metropolitan city being under $30,000 a year prior to the pandemic, which we know that has drastically changed since then. And so we have continued our organizing through narrative work, essentially. A lot more residents are in their homes. They're looking at these public access television stations. So we're intervening in these community meetings. We're calling into these community meetings. We're testifying online for the public to hear. We're writing articles. We're organizing podcasts. We're dropping flyers at grocery stores. You know, when you take your trip to the grocery store, if there's information to leave, you leave it there. If you live in an apartment building, you're posting it in your hallway. And so every mechanism that we maybe was secondary when we had more access to the public is now primary. We're using the telephone. We're calling folks, a regular phone tree. You know, the way that systems target you when they want information from you, we're going back to calling our our relatives and residents in the city and informing them of what the situation is. There are more people that have access to the internet. It's still a disparity, a drastic disparity, but you have these corporations that now know that they have an opportunity to benefit from this crisis that are now offering up these tools that they should have always offered up. And so we're using that as an opportunity to access families and get information to families in a way that we didn't have an opportunity to before. And I'll finally say our Equitable Internet Initiative through Detroit Community Technology Project has organized an intranet, a system where community members can communicate with one another if they don't have the internet. And so it's giving them an opportunity to send emergency response information, to communicate if there's a need in the neighborhood, to organize mutual aid systems. We've really come together, and we've also utilized petitions. The petition has been a tremendous opportunity to hold our city government accountable for water not being on, and our state government. We were able to push our governor to issue a statewide moratorium and an executive order to have all the water restored in this, not just the city of Detroit, but the state of Michigan. And so we've leveraged social media, we've leveraged petitions, we've leveraged podcasts, we've been calling each other, we've been posting notes. And so we won't allow for this crisis that they've leveraged as an opportunity to further dehumanize us, to stop us from our organizing. And so we will continue. We know that we're fighting for our lives very literally in Detroit. And so every mechanism that is at our disposal, we will tap into. And so whether it be Zoom, whether it be calling into public access, whether it be writing a note and leaving it somewhere if we do have to leave the house for essential trips, we're going to leverage all those opportunities. And so I don't know how much time I have, but I'll leave it there.
Thank you so much, Tawana. We heard just resilient, practical, creative responses from both you and Antonio. So excited to dig into those a little more in the questions. Over to you, Michelle.
Hey, everybody. Thanks again for having me join this really, really important conversation. I'm already learning so much and getting inspired by all the creativity that Antonio and Tawana already shared. And I had the honor of seeing Tawana speak at Data for Black Lives last year. So it's an honor and just a little intimidating to follow her, but excited to share a little bit more with y'all about what we're trying to do in Equal Health, which is an organization that I'll speak a little bit about, as well as our campaign against racism in health specifically. So we're organizing health providers all around the world. It's a little bit of a different constituency than has been shared so far. It's kind of the gift and the curse. You all probably know that health providers are not the most politically aware people, unfortunately. Historically, maybe that will change, and maybe COVID will be one of the things that makes that change real. But political education is profoundly lacking in health education and amongst the health provider community. And that's actually the people that have found each other in Equal Health and in our campaign against racism in health. Generally, I would say the unifying principle of how we came together is all of us are frustrated or angry or beyond exasperated with how inequitable the system is and how health providers often contribute to those inequities by a lack of political education, a lack of understanding how we can be complicit with systems of oppression as health providers unless we understand which side we're on. And so Equal Health actually came about in 2010 amongst a group of health providers in Haiti and in Boston. And many of you remember, I'm sure, the January 12th, 2010 earthquake in Haiti, where over 300,000 lives were lost, probably far more. One of the most consequential human tragedies of the 21st century. And many of us came together after that earthquake to really contribute in a longitudinal way. Many of us were at the time in training in Boston in hospitals that are overprivileged, elite, and over-resourced. And found that what we were seeing in Haiti, many of us, again, had been working in Haiti before the earthquake happened, was a tragedy of resources, a tragedy of justice, a tragedy on many levels. And our friends and colleagues in Haiti that we had already been working with around various things really encouraged us to focus on investing in the health education system and the genius of the next generation of health providers. And so over the past 10 years, our work has really evolved in lots of different ways, starting predominantly with social medicine and kind of political education of both US and Haitian health professional students. And now has really grown into a platform called the Social Medicine Consortium, which has really become a place or a virtual space, as I guess we could call it, for health providers from all around the world to really come together and deepen our analysis, deepen our critique, and deepen our community and relationships despite being most of the time virtual. So in a way, again, the gift and curse of what we've been doing is we have had kind of a virtual connection for quite some time, and I think have continued to still shift tactics in lots of ways in the COVID-19 era, but we're already using lots of different virtual and online platforms to connect ourselves. Specifically the campaign against racism, which I want to share a little bit about. And then I want to kind of get a little bit into economies of care and the challenges that we're seeing and trying to address, and then get into a little bit more about what we're kind of trying to imagine right now, what futures we're trying to imagine in the health community. But the campaign against racism came about 2 years ago through a partnership and mentorship by Kamara Jones, who's a family medicine doctor and epidemiologist who was president of the American Public Health Association and has worked on issues of structural racism and health for decades. And she was calling for a campaign against racism. We decided to take up, in partnership with her, kind of the global and international solidarity component of that campaign. And so in these first 2 years of our campaign, we have now 22 chapters of the campaign across about 8 countries. About half of those chapters are in the US, and they're in places like Boston, but they're also in places like New Orleans and Nashville. And then we have folks in Haiti and Zimbabwe and Uganda and Rwanda and Mexico and Brazil and Palestine, who have really come together, again, with that shared frustration and also shared analysis of what the problem is. I would say our campaign has evolved in some really powerful ways, again, despite the virtual connection of many of our chapters and communities. We've been lucky enough to be able to bring people together about once a year in person, but most of our work is done through a virtual community, through things like Zoom and WhatsApp, as have been mentioned. But this second year of the campaign, we've really focused specifically on racial capitalism as our unifying kind of ideological framework and analysis. And that has been spot on. I mean, there's nothing that's more evident in COVID-19 than racial capitalism. And so it's been timely in that we've been able to really spend a lot of time, even before COVID-19 happened, getting health professionals to understand theory and understand racial capitalism and understand, you know, things like Cedric Robinson, who you don't read in medical school by any means. And so it's been a really important journey for us, and again, has taken us to a very clear understanding of why COVID-19 is affecting who it's affecting. I think just in terms of context, you know, we are seeing things like the fact that Haiti, for example, has 30 ventilators for the whole country of 11 million people. And it's not to say that the needs here in the US are not as bad, and we would never want to compare need and suffering, especially human suffering. But what's happening in a country like Haiti is really incredibly difficult. And in a historical context of Haiti being a world leader in justice, having been the only country to successfully throw off the chains of slavery and become an independent republic of formerly enslaved people in 1804. So there's so much leadership and history there. And at the same time, unfortunately, in the COVID-19 era and in an era of ongoing imperialism and global neoliberalism, there is tremendous suffering happening in Haiti right now. So instead of, instead of that information being lost upon the American press, that experience amongst our Haitian health providers who are in the campaign, they're sharing that with folks in, like I said, Palestine or Zimbabwe and here in the US. And so there is a global consciousness building piece to the work that we do, and a global kind of, to both of Antonio and Tawana's points, a global narrative and a global kind of story and experience sharing component to what we do. At the same time, we see in Massachusetts, for example, which is the state with the highest rate of health insurance in our country, we have like 98% health insurance coverage in the state of Massachusetts, and yet if you look at Boston, there's a 30-year life expectancy between one of the richest white neighborhoods and one of the poorest Black neighborhoods, right? And so we know that health insurance is not the answer to health inequities, right? It's a part of it, but it's not the full answer. And so I think part of what we're seeing also right now is this interest in kind of making a leap forward in our demands, right? The US demand has been Medicare for all for a very long time now, and that's not big enough. And so how can we use this time and space that COVID-19 has, in a lot of ways, unfortunately, put us into to really reimagine and rethink. And so that takes me to just a couple of thoughts about kind of the economies of care in the medical industrial complex and how we're seeing that in the campaign. And I just want to share, a couple of specific things that we're seeing and following, and then I'll take just a moment to talk again about what we're kind of imagining going forward, and then I'll make sure that I don't impinge on Shawn's time at all. But really briefly, we're seeing that what's happening in the US and globally is that Black people are dying and white organizations are getting money to fix it. And that pattern is happening over and over again everywhere we look. You don't have to be, you don't have to be outside the US for that pattern to be happening. That's happening here. It's happening in a lot of places. So we're concerned about that. We're watching that. We're thinking about that. We're also looking at what do we do with data? How can data not just be this kind of physical science epidemiologist tool for surveillance and tracking, but an actual lever for change? And we see that, at least in the US right now, the federal government has less explicit, transparent, and high quality data than journalists at the New York Times. And what does that mean for us to not have that data available? And also, what does it mean to not use that data as a surveillance tool? So how do we move beyond those issues of just data transparency into actions that really align resources with need, instead of what has been historical, as Dr. Kamara Jones always says, inaction in the face of tremendous need. So how do we get out of that pattern? To be determined. We're also looking at the fact that a lot of advocacy asks right now are a result of capitalism. And the things that people are asking to be fixed are all things that are a necessary part of a capitalist system. So things like drug prices being too high, rural hospital closures, urban hospital closures, supply shortages of PPE, supply shortages of drugs, a lack of an adequate health workforce. These are all things that are a result of a system of racial capitalism. And if we don't see it as that, we're not going to come up with the right solutions. Our chapter in Palestine, for example, has prior to COVID-19 been looking at issues of generic drug prices and drug pricing issues, and now are looking at similar issues. Our chapter in Atlanta was looking a lot at incarcerated individuals and how they transition out of incarceration back into the community. And in the COVID-19 era, that's what they're also looking at. Other chapters have changed a little bit what they're looking at. Our chapter in Nashville, for example, has been trying to get rid of race-based correction of kidney function, which is a racist legacy of eugenics in medicine. And now with the COVID-19 era, they're still looking at that because there are unbelievable inequities in kidney disease around COVID-19 as well, and that's coming to light more and more. And then the last quick example, again, before my final comments, are just crisis standards of care, which I'm sure many of you have been hearing about. Crisis standards of care are basically what happens when you've got one ventilator and two patients. And, you know, my 90-year-old grandma said it very clearly. This is not some, overly complex thing to understand. If you have a white physician and you have a Black patient and a white patient and there's one ventilator, we know that the white body is valued over the Black body. That has been our country's history for forever. And so who's going to get that ventilator? Now, it might be under the guise of, well, people with more comorbidities have less of a likelihood of surviving, so that's why the white patient gets the ventilator. But we know what that is code for. And if we don't see it as that, again, we're going to miss the boat, and us health providers are going to think we're helping, and we're not. So again, how do we really just make it that simple? So just finally, to end, I'll say kind of what are we imagining right now? We're actually, I'm supposed to put a plug, we're on Friday going to be doing a cancel the debt party. So like the things that we're imagining are the end of debt. How is it possible that the IMF, the International Monetary Fund, is saying we're going to cancel the debt for 6 months and then you'll be fine, right? I mean, that makes absolutely no sense. We thought before COVID-19 that should be canceled. It should be canceled permanently. So our cancel the debt action this Friday, I think, is one leap forward in our asks. I don't think we've figured out what the leap forward in our healthcare ask is just yet, but I think we've got more space and more time to explore that now than we've had previously. We're meeting a couple of times a week now, whereas before we were meeting once or twice a month as a full campaign. So that is exciting, just to have the space and the time. And then we're clearly calling for not returning to normal. And I know a lot of organizations are calling for that. We know what the normal was pre-COVID-19. It was a path to destruction of Mother Earth. So how do we keep uplifting and keep exploring what that call to not return to normal is? And how do we continue, again, to manage our own anger with all of this happening and unraveling in front of our eyes, and continuing to center a racial capitalism lens in the work that we do through Equal Health and through our campaign. So I'll stop there. I think I went over, but I apologize.
Thank you so much, Michelle. There was so much in there, and I think some of the themes that we wanted to pull out in the question section related to how do these efforts connect to transnational campaigns is something that you really brought out really poignantly in the work that you're doing. And so I would ask the others to kind of think about that a little bit, and also an opportunity to dream bigger. in a time of crisis. And so thank you. Now over to Shawn. Take it away, Shawn. Thank you so much.
Thank you so much. On that note, I thought I would start with a quote from right-wing economist Milton Friedman. Only a crisis, actual or perceived, produces real change. When that crisis occurs, the actions that are taken depend on the ideas that are lying around. That, I believe, is our basic function, to develop alternatives to existing policies, to keep them alive and available until the politically impossible becomes the politically inevitable. So I am 38 years old, and my life has been shaped by the world that Milton Friedman created. My family is from Kerala, India, and immigrated to Iowa in the early 1980s when Milton Friedman's ideas were ascendant. And we suffered, like everyone else in Iowa, from the 1980s farm crisis. And in the early 80s, we know that like neoliberalism, privatization, extreme capitalism, and all of those ideologies kind of found their massive flourishing. And our family was unemployed, on public assistance, and the sort of American dream that we were promised was shifted. And we struggled a lot, and you know, like most immigrants, we're told, work hard and you can like get that American dream and like make it happen. And, you know, I did that. I worked hard, was just starting my career in this field. And then the 2008 financial crisis happened. And everything that I had been working for went away, all the jobs went away. And I actually, you know, my reaction was actually to go to law school, to go to NYU. And there was the most law school applications in history ever before, ever since, because everyone had the same idea. And like, that's debt that I will probably die with now. You know, just on March 22nd, my brother had a baby, and that first grandchild in our family is being born into another crisis. And, you know, I'm thinking about, and, you know, holding Tawana, all the people that you mentioned that are dying in Detroit. I'm in Brooklyn right now, another epicenter. And, you know, I think like these crisis moments are moments when a new world can be born. And I'm thinking about, you know, my niece who I haven't been able to hold, and I don't know when I'll be able to hold her, and like the world that she'll be inheriting and how many more crises we'll be facing. And like everyone else has said, like the COVID crisis is unprecedented in many ways, you know, like 50,000 people dead, 26.5 million people unemployed, but also it's revealing like a lot of the crises that are much, much deeper than recent history. And that was my job, and continues to be my job, is to deal with the economic and environmental crises that have been facing rural America for decades. But the reality is also that in the immediate term, even though these problems have decades-long histories, in the immediate term, we know that our political leadership right now makes a massive difference. We know that if Donald Trump had acted 2 weeks before, 90% of deaths could have been avoided. That's about 45,000 people who would be alive, who are instead dead because of our political leadership right now. And coming from the Midwest, I felt a responsibility because, you know, that switch of political leadership, those 45,000 people who could be alive that are now dead, it was just a few people in just a couple states. And if a couple people in a couple states in the Midwest had gone the other way, we wouldn't be in this situation. We'd be dealing with the lasting legacies of structural racism, the deep decades-long kind of ravages of neoliberalism, but the specific reaction right now would not be the same. So my work is thinking about how to deal with the economic and environmental crises in a way that can move the needle in rural areas in the Midwest, just a little bit, just enough so that we can flip those states to get a different leadership. So it's both short-term and long-term. And my plan was before to do all the things that you were mentioning, Sukti. I was planning on doing one-on-one meetings, face-to-face, going in, putting people together into small rooms to do political education, then moving them into action, into rallies, and bringing a bunch of people together in protest, right? Like all of that is now not possible, but the basic components of that we can still try to do. And I think of them in, 3 different basic buckets. One is connection, like building connection between people, building community between people, and confronting power. And we can't do the same things with the same tactics that relied on face-to-face interaction, but there's a lot of other tactics that we can use. One of the things that we've done, I work at People's Action, which is a national network of grassroots organizations that each have, that build base in their local communities by working with multiracial, working class, and poor people, and then developing campaigns and interventions according to the needs of those folks. There's 40 different organizations in our network that operate in 28 different states. And all of those organizations are doing a lot of the tactics that other folks have mentioned already, right? Like instead of knocking on doors, we're texting people, we're calling people, we're doing Zoom calls to kind of build community. We're trying to move as much as what we were doing offline to online. But obviously just doing what we were doing in a pre-COVID world and moving it online is not sufficient and not enough. And we're, like everyone else, struggling to figure out how to meet the scale of this moment. So one of the things that that we're doing in order to kind of shift what's happening in rural America to turn people away from the politics of hate towards a vision of the future that they can actually believe in and see themselves in is something called a deep canvas. A deep canvas is different than a normal political canvas where the priority is to try to hit as many doors as possible and talk to as many people as possible, identify supporters, and make sure they turn out. A deep canvas is specifically targeted at conflicted voters to have a deep, longer conversation of about 15 minutes or more and help them resolve that conflict towards, like our point of view. And I think this is something that everyone mentioned in one way or another, is that making meaning of what's happening now is going to be incredibly important. And especially for me, when I'm thinking about trying to move the margins in a way that we can change leadership. There are already traumatic worldview shaking events happening now, right? Like, I don't think any of us are untouched by this. We all have we're all either sick or at risk of being sick, losing our jobs, or have someone very close to us who is losing their jobs or their health. The scale of this crisis is far too large for any of us to be untouched by it. And people are going to be making meaning out of it. And the right wing is already making meaning out of it. So you can, in my home state of Iowa, the governor has not issued a shelter-in-place order, even though several meatpacking facilities have become hotspots of COVID outbreak. And the way the right wing and our Republican governor is making meaning out of that is saying that, well, those are Mexican people that work in those plants, and those Mexican people live in close quarters, and that's their fault, right? So it's the same neoliberal sensibility of individual responsibility instead of thinking about things systemically. And I think the core insight of what the work that we're doing, to me, that was new to me, is that we think of people as existing on a spectrum of like right wing and left wing, and there's some people further right and some people more in the middle. And what's actually true is people hold two conflicting viewpoints at the same time. So they can say, you know, like, wow, I'm so grateful that the grocery stores are open and so grateful for those workers that are like helping me be safe. And they can also think like $15 an hour just to stock shelves, like that doesn't make any sense to me. And they're getting every day a dominant narrative that is pushing them towards blaming individuals, blaming people of color, blaming Black people. And I think I would note that you're seeing like these unhinged protests to reopen the economy. You only saw when the threat of the coronavirus was about old people and people with pre-existing conditions like asthma, you didn't see those protests. As soon as we got the racial data that Black people were dying at greater rates, that's when those protests started. So I think the making meaning of what's happening is incredibly important, and people are getting a lot of are seeing with their eyes things that conflict with the dominant narrative they're being fed, right? Like if anything shows us how connected we are right now, it's a pandemic where our health is dependent on the health of the person with the least access to the healthcare that they need, right? Like if your grocery store worker cannot take paid sick leave, you are at risk. So that is a reality that people are seeing at the same time that they're getting a dominant narrative from the right wing. And this is particularly challenging in rural areas because they are information deserts and they're extremely isolated. So 70% of rural people, their primary news source is Fox News. And then, you know, this is a survey question where you can click multiple things. The only other thing is Facebook, that's 70%. And then local TV news is like 30%, and local newspapers are like 10% or less because there just aren't any newspapers anymore. And I think one of the problems that we've had is that we're not contesting for making meaning in these places. So people are only getting one side of the story, and that story has been consistent before this, and they're playing this out right now as well. Your problems are because of Black people, people of color, who, you know, before this, they're the ones that are like taking government assistance, making you pay taxes. Now, you know, the script is changing slightly, but it's the same idea. And meanwhile, we're not out there actually presenting reality. So what we're doing to build connection and community is every Tuesday, we are texting as many people as we can. So it's harder, like the connections aren't as deep when you're not face-to-face, but the scale of who you can contact is much higher. In an hour, I can have 500 different text conversations. And then we try to connect people to a deep canvas where we are talking to people for 15 minutes at a time. And then the first thing that we're asking them is just, how are you? How are you and what do you need? That's the first thing that we ask. And people are really moved. People are isolated and people aren't talking to a lot of people. And just asking that question puts people in a place where they're ready to listen. They're ready to listen to you, and you can start a conversation about, you know, like about everything that we're facing. Like, don't you think it would make sense that testing would be free? Don't you think it would make sense that treatment would be free? Starting those conversations, and the most important thing is asking those people after those conversations if they'll volunteer to make more calls. So we have a system, we implemented a system where every Tuesday we're texting people, every Wednesday we're doing these deep canvases, and we focus on different states. But the main, that obviously gets the work done of making those contacts, but more importantly, we're modeling a way for our affiliates and anyone else. We're modeling a way for our affiliates and anyone else to do these trainings themselves. So we bring people onto a Zoom call like this, talk through a deep canvas conversation script, and then come back together and debrief it. What worked, what didn't, what are our results? And that is a way for all the organizers who are on that call with us to actually replicate that in their respective organizations and branch out there. So
Shawn, I'm so sorry.
Yep.
I'm so sorry. We only have a few more minutes, and
Okay.
I said I wouldn't do this, and then I realized we only have 4 minutes. And so I wanted you to just give a second to finish your thought, and then I'm just going to ask one question to people on the panel.
Yeah, so I think that's basically it. We're trying to build connection and community through these deeper conversations. I think the broader question that we're still grappling with is how to confront power effectively when sometimes petitions and phone calls and things like that start to lose their power over time. Yep.
No, I think there was so much there, Shawn. Thank you so much. I think the honesty and putting things in context was so important. And so I want to try to synthesize in the next 3 minutes a couple questions that have come up. And Michelle talked about this. I think Shawn did as well. But to Tawana and Antonio, if you were to dream big in this moment of crisis, what is the opening for radical change within that you see that this pandemic provides for the communities that you work with, and who would be the target audience for that kind of pressure tactics? Like what would you imagine and how would you get there? If you can just answer that question. And I think this also would apply to Michelle. There was a question about who is the audience that you guys are, who's kind of the target pressure point audience for the work that you do. And Shawn, I think if you want to add anything else on to this question, we would love to hear from you all. So maybe Antonio, starting with you again.
Wow, what is the opportunities, right? So I think when we hear about these mutual aid funds, right, that are occurring, it really shows our potential to care for one another and to create alternatives outside just hand-me-downs or cash assistance programs, right, that really are for all and that won't exclude anybody. And so I see that as a real potential of what we can create alternative to the capitalist system that we have, right, which we, of course, have identified as one of the main contributors to the effects that COVID-19 is having, especially in communities of color, right? And if we don't make that assessment right now at this moment, then I don't know when we will be able to make it again, right? And so I see that as the biggest opportunity that we have. I think with the targets that OCAD have, right, which are very direct towards ICE and the control that ICE has in the terrorization and detention of undocumented immigrants, that is our main target, but we know that it goes beyond that. And I do think that it needs to require a lot more polarization, especially with those that categorize themselves as kind of in the middle, right, of the political spectrum, to understand that I believe that Shawn is completely right. We're only as safe and as healthy as the access to healthcare that our essential workers are having, right? And those that either not having the proper access to healthcare, right, then none of us are safe, regardless of what privilege or what access we might have, right? Because we're still going out, we're still going and getting groceries, and we're still having contact with other individuals. But I will say that we need to identify a common target, right, which I think at this moment of time, it really is capitalism itself.
Ashe, thank you. I'm going to be quick. I recognize that when I organize for Detroit, that I'm organizing for the world. Detroit has had a global dominant negative narrative for a half century. Any place outside the world that I've traveled, folks have asked me almost the very same questions about Detroit. And when there's a prevailing narrative, it allows for policy to be implemented in a predominantly Black city and then rolled out all across the world. And so I'm channeling Michelle right now. I'm going to say this. It reminded me of a really quick story. When I was in Palestine organizing around water, I asked one of the organizers in Palestine, what can we do to support you? Because, no matter how oppressed you are in America, when you go somewhere else, American exceptionalism can creep into your psyche very quickly. And so I said, what can we do to support you? And the organizers in Palestine said, liberate Black people in America.
so beautifully said. I mean, I feel like we could just stop there, but really, really briefly, I'll just say, I think everything has to be reimagined, right? I mean, we can't stop at anything short of everything. And I also think, at least for our work, a lot of the target is ourselves, is like fellow health providers, because we have been such right-hand tools of the state for so long, and we don't have to be. So a lot of it is critical consciousness and political education of health providers. So targeting our professional community that so desperately needs to change profoundly. Otherwise, we should not be the heroes of this pandemic. And then also, I would say kind of the kind of professional societies and big neoliberal healthcare organizations would also be some of the targets, but it really varies depending on the chapter of the campaign. A lot of their local organizing work is really focused on how racial capitalism and structural racism is manifest in that particular community. So it's for global community and global critical consciousness building and ideally local action.
Shawn, please, if you want to jump in, yeah.
I'm just agree with everything everyone else said, 100%.
I love when, you know, you have a good group of people when they lean on each other in that session. It means that there's a lot of brilliance that's emerged. And I apologize for having to cut things short. I could have sat here for much, much longer. I think one thing that really came out practically from each of you is real clear advocacy actions that you're engaged in. And we want to be able to make sure we harness that and share that with the community that's joined us today and further. So please do send that on to us, and we'll make sure that that gets out there. And just many, many thanks to each of you. You are on the front lines of this work every day, and we know it's exhausting every day, and even much more today. So thank you for taking time and being with us and sharing a vision of what might be possible or what will be possible for the future that we want. And so we're grateful. And to those of you who joined in, thank you for being with us. There will be a recording of the video that's going to be available on the site, the COVID-19 Justice site, and there will be closed captioning that's going to be available as well. And a plug for next session, it's going to be this Thursday, April 30th. It's called COVID-19 and Mental Health, Wellbeing and Resilience During the Pandemic. So we look forward to seeing all of you for the next session, and many, many thanks to our speakers and to the coordinators for the program. Take care, everyone. Stay safe. Bye-bye.
Thank you.